Hi everyone. I just wanted to talk for a minute about articulating SMART goals and how to do that appropriately. I'm going to attach a document as well to this announcement so that you can see it written out. So SMART goals contain 4 different things. So we're looking at a problem, a goal, an objective, and intervention. So the problem is that major presenting problem that you're going to tackle. So if you have a client that comes to you and says that I am so depressed and I am so sad all the time and I feel hopeless. Okay, so what we're going to tackle is feelings of depression. So we would write in the problem that our client is experiencing symptoms of depression. Great. Our goal then is going to be what is going to happen in the time frame that it's going to happen in. And so what's going to happen is hopefully that our client is going to reduce the overall frequency, level, and intensity of their symptoms of depression so that it is no longer causing a problem within their daily functioning, and that this is going to happen within 2 months. So that's our goal. The objective is what the client's going to do to achieve that goal. So the client is going to maybe learn 2 coping skills or relaxation techniques to reduce feelings of depression and participate in gratitude journaling 1 time per day over the next 2 months to decrease the symptoms of depression to less than twice per week. And then the intervention is what the counselor is going to be doing to help the client reach that goal. And so in this case, the counselor is going to teach the client those coping skills and relaxation techniques that we talked about to reduce those feelings of depression and those symptoms of depression, and is going to teach the CBT technique of journaling for gratitude, as well as guiding the client through the CBT process to maybe help counter negative thought patterns, so that the so that the depression symptoms are occurring less than twice per week within the next 2 months. So just make sure that you're always being very specific about the time period, what the goal is, what the client is going to do, and what you as the counselor are going to do. Also remember when setting up these goals with clients, it should always be a collaborative process. We don't set goals for our clients and expect them to work on goals that we think is appropriate. We always want to set goals in collaboration with our client so that our client is working on the goals they want to achieve. And so that doesn't mean that if we can see something that might be useful for them, that we can't talk with them about that and say, hey, I've seen this theme of you feeling more hopeless, when you're not taking your medication. Would you consider taking your medication more frequently so that you're adhering to taking it as prescribed? It's okay to do psychoeducation on something like that and talk about the benefits of medication and talk about how the medication works, might set their mind at ease. Maybe ask them if they'd be willing to speak with a psychiatrist so that they're at least making an educated decision before choosing whether or not to take those medications. But we don't make the goal of client is going to adhere to their medication regimen without talking with our client about if that's something they want to do. So just keep that in mind, that we should always be making goals in collaboration with our client. Also remember not to get too caught up in all the daily life issues that the client is having. We care about that, but ultimately goals should be focused on improving our client's mental health, because we as counselors should be focused on our clients' mental health. So we don't want to get too caught up in, medication manage or medication adherence, and, client will, um, you know, read 3 books per week to make themselves feel more intellectual or something like that. We always want to be focused on our clients' mental health, and goals should be focused on their mental health. So just keep all that in mind, and I will post this PDF, just very short little form to show you kind of an example of how to write out a SMART goal. So if you have any questions, please feel free to let me know. Thanks.